David Blyde. I'm a consultant veterinarian and I've come to Zoodoo this week to do a few things. One was to health check some of the zebras that are down here. So with the zebras, they're fairly similar to horses, and the things that can go wrong with horses are hooves, teeth, and they're very susceptible to tetanus as well. So prophylactic or preventative medicine is very important in zoos, and so we took the opportunity to immobilise 3 of the animals here, trim their hooves, check their teeth, vaccinate them for tetanus, and grab some blood to look at their haematology and biochemistry to make sure everything's, make sure they're all healthy. With the zebras here, they're obviously not halter trained or broken in, and so the procedure's a little bit different in that we have to use a drug in a projectile dart to sedate them so we can get close enough to get our hands on them. They're not the easiest animals to immobilise because they're quite flighty and a number of things can go wrong, but the procedures went pretty smoothly, really. Apart from the weather, it was pretty good.
Hi, I'm Gertie and I'm a vet with Kingra Equine Vets. So we're here today at Zoodoo to assist Dr. David with looking after some zebras, doing their health checks, and obviously zebras are a little bit different from the horses as in that they're a wild animal, so anaesthetising and sedating them works a little bit different, so David's been doing that for us.
So what time is Gardy? 10:29. 10:29. With these procedures on exotic or zoo animals, we like to do it as quickly as we can because whilst they're down under the drugs, they're compromised physiologically. So we try and do it as swiftly as we can without missing anything and without panicking. So yeah, it's good to have a team there, someone to do the hooves, someone to do the teeth, and making sure that we've got all the samples and did the vaccination as well. Okay, I'll do the tetanus. Do you want to see if you can get a gag in there, Gertie?
Yep.
And just have a feel of his teeth?
As far as teeth goes, the zebras are actually fairly similar to horses. They're a little bit more like donkeys as in that they have a little bit less room in their mouth to work around, but anatomically they're actually fairly similar. They lose their baby teeth at a similar time, so yeah, from that point of view it's not much different. The biggest difference today, I guess, is that something that we haven't done before is usually when we do dentistry procedure on a horse or a donkey, we do that when they're in standing position because they're just sedated. With the zebras we can't do that because they had to be fully anaesthetised and they were lying on their side, so just a bit of improvising, but that's part of being a vet.
G'day, I'm Josh Srodka and I'm a farrier. Farrier does horses' feet predominantly and donkeys, and we're here trimming the zebras today at Zoodoo. So the difference with doing zebras as opposed to doing donkeys or horses is they're a wild animal, so we've got to do them under sedation while they're laying down and put a bit of shape back under them for the year.
It's all worked really well. They got a nice clean bill of health, and we will get some blood off to the lab as well to make sure there's nothing otherwise nasty brewing there.
Today's going well. Feet are good, a bit of length in them, but we'll put some feet under them and they'll get through the year.
So all the procedures went pretty smoothly, really. We managed to do what we wanted to do, and hopefully when we get the blood results back, we can confirm that all the animals are doing pretty well and they've had their vaccinations now, and so we probably won't have to look at them for a couple of years or so.